Value-based care first became a term that we started talking about over 10 years ago now. And it's really now that we are starting to see the results of that way of delivering care. And the Medicare Advantage model is actually a perfect model to be able to support the value-based care arrangements that we have. We think it's really important to generate the proof points around the impact of value-based care on our members, on our clinicians. Being able to produce research that is rigorous, that is published in top-tier journals around the impact that value-based care has on health outcomes and costs for our members and the experiences of our clinicians is really important to generate further excitement and desire to accelerate the transition to value-based care in this country overall. Over the past several years, Humana Health Research has done quite a bit of work looking at the impact of Medicare Advantage versus traditional Medicare on health outcomes and quality for our seniors. We've also looked at the impact of value-based care versus non-value-based care or fee-for-service within Medicare Advantage on our seniors. We took it one step further. We worked with some researchers at Harvard to understand whether or not the clinical model that we call senior-focused primary care has an impact on health outcomes for our members compared to other types of primary care. And what we found is that it in fact does. The biggest takeaway from our senior-focused primary care study is that for our members who see physicians in senior-focused primary care clinics, they have much greater access to primary care, and we see that they probably have better quality and health outcomes as well, although we need a little bit more research to understand if that's true. I think the really exciting result from this study, though, is that we see a pretty significant reduction in the disparities in care between our Black and white members, meaning that the impact of senior-focused primary care is greater for our Black members than it is for our white members. In other words, the senior-focused primary care model appears to reduce healthcare disparities for our members who are Black. And that is just such an incredible finding. We know that our members have a much better experience when they are part of senior-focused primary care clinics. We think that they have better outcomes as well, but we need to really understand what are the things that most directly contribute to those better outcomes. And so I think we have a lot of opportunity over the coming years to strengthen the clinical model even more to serve our members.